dental provider burnout. In today's video, we're going to talk about a topic that has continued to stay very hot in our profession. Our profession, unfortunately, has seen massive increases in turnover since COVID, and that has put stress at the individual office level, trying to keep up with patient demand. All of those type things are adding to the additional stress load of the providers. For us at Lad Dental Group, seeing these trends continuing to come, we've tried to incorporate a few things to allow our providers the ability to not get into decision-making overload and to actually be able to take a breath once they leave the office. To me, when you're providing 40 hours of patient-centric dentistry, that's incredibly stressful. That's draining. It's tough on your body. You're working in a very small area, limited visibility. It's a wet environment, and everything you need needs to be dry so you can get bonding. I mean, just the environment that we work in is already very, very stressful. Then if you're going to put in running a business on top of 40 hours of patient-centric dentistry, when the doctor only drives revenue seeing patients. So when you're doing admin work, you're doing that for free. When you're doing facility maintenance, when you're doing regulatory compliance, all of that stuff, there's no revenue for those tasks. So for us, providing a team for our doctors. So we have revenue cycle management. So they're not calling the insurance company asking about an adjustment. They're not worried about credentialing. They're not worrying about the roof or the vacuum or the suction or the chair or the hiring needs of the staff or the benefit changes that are coming from our health insurance companies. I mean, in today's day and age, there's so much noise. Things change so quickly. And honestly, just the vendors that we have used, the amount of disorganization since COVID, to me, is out of control. I mean, we rely on a lot of really big companies, and I never cease to be amazed at even the Fortune 500 companies, how they don't know what's up and what's down. Understanding what the right hand and left hand are doing has never been harder for these companies, it seems like, at least from our perspective, that are trying to use their services. So with that, when you're dedicated 40 hours to gold standard dentistry, which is already hard enough, that doing gold standard dentistry is, again, like we talked about, incredibly difficult. It takes up all your bandwidth and it's physically demanding. I don't know how you can do that and keep up with all of the additional noise. One of the other things we've really incorporated here at Lad Dental Group that we're bullish on is AI. Dental Robot has taken off some load of our treatment coordinators in front of the house staff, and then we've used Overjet for our clinical staff. We are more high volume practices. We take all forms of insurance besides HMOs and DMOs, and because of that, we do more hygiene checks, and we do a little bit more exams than some other offices out there, especially the fee-for-service offices or the boutique offices. We are definitely not that, and because of that, one of the things we're very sensitive to is decision-making overload. Doctors have to make so many decisions on a daily basis, just in terms of clinical acumen and clinical decision-making, treatment planning, all of that stuff. Having Overjet in the background to make sure that we're doing quality exams, we're making sure that we're picking up the things that we need to be seeing, and we're not missing anything when we're doing these hygiene exams and new patient consults, all of those type appointments. So been really grateful for the work that Overjet has done. We use Denticon, and it's a really smooth transition. The x-rays, the overlay come up very quickly. There's not much fiddle factor that goes into it, and it's allowed our continuity of care to get even better. We continue to look at things the same way. We are a group practice with 20 providers, so from a continuity of care standpoint, it's really increased how we treatment plan. So comment down below. Let me know what you guys are thinking. Let me know if you're a doctor, what are some of the things that really add on to that burnout factor. If you work for a DSO or with the DSO, how have they helped or not helped? Again, you guys know that not all DSOs are good DSOs. Some of them really are 4-letter words, and those are the ones you need to avoid because they're going to make the burnout even worse. But I think a DSO that truly understands it has to be patient-centric, and it has to be provider-centric dentistry. Us as managers, we only survive with really good dentists, and our patients only show up with really good dentists. So I think when you understand those principles, it allows the kind of operating prism that we look through to be a little bit clearer. So again, comment down below. Let's avoid burnout in 2025, and let's make it a great year.